So today I'll be giving Haley 3 different examinations, one of the hip, one of the knee, and then various muscles that move the leg joint. So first, can I have you sit down and we'll be testing for your hip first. Actually, can you lay down for me with your head facing this way on this side? So first, I'm going to be doing a locks test, and I'm going to see if you have any hip impingements here or on the outside as well. Just going to simply roll your leg here. Any pain?
No.
Next, I'll be doing a compressions test. And for this one, I just need you to raise your legs, and I'm just going to push on your hip and just let me know if you feel any pain. Nope, over there.
Yep.
And then same here. So let me know if you any pain here.
No.
And then lastly, check anything here.
No.
Okay. Next, I'll be checking for the range of motion in Haley's hip. Starting with the full extension of the knee, select 45 degrees outwards and inwards, and then just an overall range of motion.
Ooh, a little tight.
A little tight. Okay. Next, I'll be checking for any lateral tension that Haley might have. And I'm just going to palpate the outer hip here, see if I feel any impingements, any pain. Let me know if you feel. Check for snapping of the hip. Cross. Doing a Faber test just to check some more range of motions. And we do this range of flexion, abduction. So we're going to come on here, and then also external rotation. Let's check for any pain here.
Nope.
The next part of the evaluation will be of the knee joint. First, I'm going to be checking the ACL of the knee using the anterior draw sign. And to do this, I will be grabbing the knee, pulling away from the femur, and just checking for any looseness of the tibia. Comparing to the right to the left, things appear normal. Next, I'll be checking the PCL with a posterior draw sign, which is essentially the same thing here, but we'll be pushing inwards. You're fine. Just checking your tibial tuberosities to see if any of them are palpating more than the other ones. Feels like your left might be a little, or your right might be a little bit more exaggerated than your left. That one that side. Next, I'll be checking the MCL and LCL of the knee, and by doing so, I'm just going to palpate the lateral aspects of the knee, checking for any pain or any swelling, and as well as the medial aspects of the knee, where the joints are located. Noticing any swelling or malfunctions of the knee. Both sides appear to be normal. Next, I'll be checking the meniscus of the knee joint, and but to do this, you need to just simply flex your knee, like so. And we're going to do a swipe. Am I regular these abnormalities there? Well, we'll be testing the meniscus. We'll be basically doing the Thiesley's test. Take the another step to the left there for me, please. And can you stand on one leg like so and just slightly bend it? Slightly bend your one you're standing on, just like so, and I'm just going to twist you here. Any pain?
Nope.
Alright, clear for now. There you go. So I'm going to have you do a duck walk, which is just simply coming here and just moving like this.
Okay.
So from that side of the couch to this side of the couch, all the way down. Any pain?
Nope.
Perfect. Next, I'll be checking for any patella issues of the knee joint, and by doing so, I'll be checking for the bursitis of the knee, any swelling on top of the kneecap here, as well as anterior bursitis as well, and swelling where the tendon attaches to the outside of the tibia. I will be administrating the Clark's test. Simply here. Knee pressure on the knee there.
No.
Next, I'll be doing the Hawkins fat pad test. And to do this, you simply need to spin the knee for a little bit and just palpate on the sides of the knee, checking for any major swelling around the patella joint, patella bone. So on this end. Relax. I'll be checking for Baker's cyst. This is a cyst that grows behind the knee joint. Basically, you just have the knee, slight flexion, and just palpate for any noticeable cysts underneath the knee joint here. Can you imagine having that? Next, I'll be checking for any fusions of the joint. And to do so, we basically just need to have the joint here visible. We're going to milk this patella tendon pocket and just see if we have any visible fluid around the sac of the patella. Got a little something going on right here. Lastly, I'll be checking the muscles that move the legs of the lower extremities. First, starting with the iliac and psoas muscles that bring the leg in full flexion. And to do so, we'll bring her leg up like so, and just lock it in this position. And I'm going to try to pull down, okay? How you gotta hold it more than that?
Oh.
Like, don't move it, don't let me move it.
Okay.
So after it's locked, we're going to add a little bit more pressure. Good. Next, we'll be checking for the gluteus medius muscle. And to do so, we need to bring her leg up just like so, just like this. And can you come up on the side more? Like so. Yep. Like so. And what you basically need to do is you just hold it in this position, and I'm going to try to push down. Any pain?
Nope.
Next, I'll check the gluteus medius muscle, and to do so, we'll bring her leg up into extension as well as knee flexion. And what we need to do is hold this position here, Haley.
Okay.
Don't let your leg drop. Yep, hold it just like so. Keep it up, keep it up, keep it up. Keep it up, push it up, push it up. Kick up behind. Hold it there, hold it there. Okay. For the hamstrings, we just have our leg, knee here, can stay on the ground, and you're just going to resist me pulling it down, okay?
Okay.
Just pull, 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 pull. To test the last set of muscles, the adductors, we simply need to have her legs, bring her legs together. And what you're going to do here, you just try to pull them out like so.
Okay.
So go ahead. Do we know they're locked? I'm going to add a little bit more resistance. Go ahead. That concludes our tests for the hip, knee, and muscles of the leg. Thank you, Haley. And thank you, Dr. Kim.